Hello, guys. I am acutely aware that I'm the only thing that's standing between you and the Saturday afternoon, so we'll try to be quick. But, I'm sure you guys are a head full of knowledge and just want to keep it simple for the last one and also make it a bit more interactive as well. So my name is Albert. I'm the Medical Administration Registrar at Counties Manukau at the moment, but I got my GP fellowship 2 years ago. But why not a different college to just more tests, more exams. All right. So just a quick hands up. I'm just curious, which district are you guys from? Hands up for Northland. Excellent, welcome. Hands up for Waitemata. Okay, that's a lot. And Auckland? Majority. Counties Manukau? Yeah, excellent. Okay, good. I just want to know what the distribution is because it's actually, it's good to know. All right, first question. If I say transfer of care, how do you guys feel? Feel free to input whatever you want into it. It's anonymous. Excellent. Cool, excellent. Oh no, bad, confused. Yep, distrust. Okay, all right. Okay, so I guess we know what the temperature is like, right? In terms of what's going on with transfer care. All right, I'm gonna have to stop there, sorry, but good word cloud. Okay, how many of you guys know about this document that came out in April this year? Hands up. Wow, surprisingly not as much. Good, but I'm glad that there's not that many, so at least this is a point I can let you guys know. This was published in April 2024. The Transfer of Care and Test Results Responsibility Principles. This came from primary care. This piece of work actually originated from primary care. The Northern Region Clinical Governance, the PHOs in the Northern Region, the clinical directors were working together with some of the CMOs from our district, created this document, and finally it made it all the way up to Te Whatu Ora, and it was published. And essentially, the main thing that it talked about is principle number 1. You don't have to read it, don't read it. I'll tell you about it. If you order the test, you're responsible to reviewing it. Anybody disagree? No? God, I heard almost a yes there. Principle number 2. If you've copied somebody a result, right? If you want to do something, it's important that you communicate with them what you actually want them to do. Anybody disagree with that? Excellent. Principle number 3. If you are copied a result, a test result, you do have a partial medical legal responsibility of actually actioning it because it has come to your inbox as well. Boo, okay, all right, excellent. I did a survey last year and I surveyed the Northern Region primary care providers, GPs. What percentage of GPs do you think are not aware of that principle number 3 in terms of their partial medical legal responsibility? If you've signed on, enter your result and see how we go. Okay, 50. Well, the good news is it's not as bad as 50%. It's about 33%. That's where the answer, at least my survey, comes from. Next question. I asked this question in the survey. Any results copied to primary care needs to be discussed with and accepted by a primary care clinician. So that could include a GP, nurse practitioner, practice nurse. What percentage of GPs agree with this response in the survey? Good. Interesting. The answer is 80%. But it's close to 100%. Something to think about. This was the respondents. I had 428 respondents from the whole Northern Region, and that's further broken down by district as well. So the majority, we can say, GPs do think that it's important to have some sort of communication. Now, this is the part where I talk about my audit. And I did lie. I didn't do 1,000 discharge summaries. I did 941. So it's not there, but it's not as catchy as 1,000. But what percentage of discharges do you think have something to hand over to primary care? Excellent. Okay, so we know where things go. Okay, all right. Feels like more than 50. How is that possible? But okay, that's fine. The true answer is actually less than 25%. Excellent. That was my response, except nobody was there to witness it while I was doing the audit by myself. 25%, less than 25%. And less than 25%, that came on a really busy day. The true numbers are only around 23 point something percent. When I looked at a less busy day, it was actually less than 20%. So we're talking about the overall amount of discharges that come from the hospital. And this data is from counties Manukau as well. Just got to preface that. We're the second largest DHB in New Zealand, just so you know, so numbers-wise, just to kind of give you guys a context. So yeah, this is probably the first myth busting that we want to do here today. Less than a quarter of stuff that the hospital discharges actually have something to hand over. And believe me, when I was doing the audit, my threshold was very low in terms of, so even things like removal of sutures, that counts as something. If they made a medication change that required us to change something on our system to make sure that we do update it, that counted as something. So my threshold for actually saying something to hand over is very low. Now, obviously, what you see in your inbox is what you see in your inbox, right? It's not always what you see when we look at a larger number. So that's why audits are helpful, although they're a bit boring to do sometimes. Okay. Very sensitive question. What percentage of handovers to primary care is actually carried out? How I came about this information was that I called up every single primary care practice in that audit and said, this is what the discharge summary says. Can I please check? Was this actually done? Interesting, interesting. It seems like we also have slight concerns for our own colleagues as well, as you can see. What I did find was that it was less than 40%, around 38% as well. Now, again, I have to be prefaced. How I actually came to that number is the fact that if primary care has actually even done anything, that counts as a success. If we need patients to do blood tests, and the patient didn't do the blood test, but we've made a task, we've done an e-order, we've made a phone call, anything that we have done as an action, that counts as a success because we can't control things we cannot control. So the answer that came from my audit data was actually less than 40%. Myth busting number 2, I guess. Now, this is what I did in the subsequent audit. I called every single GP practice up if there was something to hand over and hand it over to a practice nurse or even a receptionist as well. What percentage do you guys think was actually successful after I followed up 6 to 8 weeks later? Okay, interesting. The answer is more than 90%. Now, the reason why it was 100%, the unfortunate reason why it was 100% is because in 4 particular cases, they actually didn't set up the task recalls correctly. But when I did call the practice up, they actually said, hey, were you the doctor that called us 2 months ago? I'm like, yep, it was me. And everything was clearly detailed in the notes as well. So in reality, probably it could have been 100%. So something to think about, right? In terms of what we know and how we feel versus what the data actually shows. Last question. If the hospitals was to call for every single thing to hand over, how many phone calls do you think you would get? If you had 10,000 patients in your practice, on average per day, how many phone calls do you think you would get? Okay, okay. Good. Well, I have some good news. This is an overestimation, by the way, because this counts for every single mundane thing to hand over, from the most mundane thing, such as removal of sutures, which I don't really think that needs to be phone called. Patients see it every day. They're probably going to go get it removed. To the most kind of important things with static carbimazole. Monthly thyroid function tests, LFTs, full blood count, at the very least, to make sure it's safe for them as well. This is the number we're contending with. So this is actually an overestimation by far as well. Actually, I forgot to ask, is anybody outside the northern region here today? Oh, interesting. Oh, couple, excellent. What I can say is, because we know that this is the actual numbers that we're actually contending with, is it good? Should we actually get these phone calls from the hospital? I'll just leave it there. So Project 9 is something that I've been talking to each of the PHOs about. If you've heard about it, or if you've seen some webinars or anything, I'll be the one presenting, but make sure you attend. Look at the recordings. I'll be here if you guys want to ask any questions afterwards.